Sean, welcome. And for starters, why wasn't there more of a COVID market for you guys?
Great. Well, thank you, Kelly. Thank you, Dominic. Thanks for having me. When the COVID pandemic hit and we had to figure out very quickly what to start doing on a day-by-day basis, we focused 100% on the samples coming in the door. These are patients, spanning all disease areas from birth to death that were relying on this information. And so we really focused on keeping our production environment safe, secure, making sure to support our team in serving those patients. And our COVID testing that we stood up was entirely focused on that. And we did provide other services, background genomic sequencing services to understand what was going on in people most affected, the worst outcomes. Pan-viral surveillance to understand the COVID strain migration. And those are capabilities that we had been working on and will continue to develop in applications in the future. But really for last year, we were just focusing on the patients coming in the door, cancer patients, cardiovascular patients, women having children, and that's where we stayed.
So I'm curious as well how a lot of we know that people who, there were fewer cancer screenings last year. There are people who are now kind of realizing the health problems that they may be in. What is your company able to do in the future to help people with their health and maybe to avoid some of these outcomes?
Right, and I think this is maybe a silver lining, perhaps, for the country of the whole COVID experience, is that diagnostic information, particularly when you're talking about the scale we can deliver ahead of time, can do a lot of good. It's the old adage, an ounce of prevention is worth a pound of cure. The information that we serve can help people understand the disease risk in their family. It can help explain symptoms and phenotypes happening at a given point in time. It can help with reproductive choices for women thinking of having a child. 1 in 6 individuals has a genetic disorder, or put differently, 1 in 6 individuals' healthcare is predominantly driven by genetic information. And our focus is in getting that information into mainstream medical care for billions of people on the planet as soon as possible.
So you've kind of raised my next question, which is how much information is too much information? What happens if people who might have otherwise, I don't want to say have been perfectly healthy, but do they take preventative measures that are actually unnecessary? I mean, I think a little bit about what's happened in the breast cancer space over the past decade, for example. What do we do to make sure that this information is useful and that it kind of helps with really serious issues, but it doesn't cause people to jump the gun?
First and foremost, while we see our role in disrupting healthcare in a way, pulling in individuals, care providers, their clinicians, all the people that care for them along is essential, and has always been front and center in our approach. This information is serious information. It's the better, the faster, the cheaper we can deliver it, great. We also spend we've invested a lot in making sure to deliver that information in easy to understand what's the next steps for the patient, for both the individual and their care provider. And that's the essential piece of this all. A care provider for them, a clinician at every step along the way to make sure the information is put to use for their benefit, and not spurious chasing down false leads or even worse, doing actual harm.
Hey, Sean, it's Dom here. I guess my question for you as the CEO of a company like Invitae, when you look at the COVID pandemic and you look at your business that would kind of flourish perhaps outside of the construct of COVID, how long do you think it'll take before you start to realize some returns on the investments that you've made now that you haven't kind of gone down that COVID route over the last several months?
Sure. So it's a great question, and believe me, we've been thinking about it in a detailed way. The short of it is, it looks now as if we are emerging from the pandemic impact. All of the primary care, the specialty care, it seems like this is now coming back. These are very important pieces of information for clinicians and patients to have. And it looks like we are emerging out of the pandemic impact period. So I would expect to see the business continuing to clip along at the rapid growth we've been experiencing the last couple of years. That's the way it looks at this point in time. But it's around the globe, there's still spotty impact from COVID that we're still pushing through.
Shepard Smith here. Thanks for watching CNBC on YouTube.